Story 1. Sudden change in vision. In my case, it turned out to be a brain tumor. I waited too long, and now my vision loss is permanent. However, I went early enough to still be alive. Story 2. This might not be an immediate trip to the emergency room, but it certainly requires making a doctor's appointment as soon as possible. If you notice a red spot on one breast that isn't going away, new orange peel-like dimpling on one breast, or if one breast appears swollen, any of these can be signs of inflammatory breast cancer. This is a particularly aggressive form of breast cancer that is usually only found in more advanced stages. Typically, there is no lump present. Story 3. Headache and a neck so stiff that you are unable to look straight up may be a sign of meningitis, which is inflammation and swelling of the brain. This condition can progress to a point where the brain presses down on the brainstem, potentially becoming life-threatening within hours. Story 4. A migraine that is more painful than usual. A stroke is not always accompanied by the other well-known symptoms. I am on blood thinners now. Story 5. I got a small cut, a little more than a scratch, on my arm while cleaning under a conveyor at work. It was black with coal dust, so I rinsed it off. I didn't give it a good soap and water scrub until I got home several hours later. A few days later, I had a dark red bump that looked like a pimple where the scratch had been. I figured it could be an infection, but there was no pain or discomfort, so I thought it would heal. After a few days of it remaining the same, it suddenly grew larger and looked worse, but still with no pain or discomfort. I decided I needed antibiotics, so I made an appointment with my doctor. It was going to take a few days. When talking to my mom, who is a nurse, on the phone, she said it was serious, and if I couldn't see the doctor that same day, then I needed to go to urgent care. I went to urgent care, and the nurse practitioner didn't seem too worried. Then I rolled my sleeve all the way up, and they saw red streaks going from the infected area up toward my armpit. I was very surprised by what happened next, as I imagine people in urgent care see all sorts of bad stuff. They became alarmed and said I needed to go to the emergency room immediately. They asked if I felt okay and could drive myself. When I said yes, they said they'd call the hospital, provide them my information, and let them know I was coming. They mentioned I might have to stay for a couple of days on intravenous antibiotics because I had sepsis, an infection spreading through my bloodstream. I had to get lots of medicine but only stayed in the hospital for one day. Apparently, it was serious because once the infection passes a certain threshold, people can go from feeling fine like I did to severely ill in minutes. Make sure to clean any cuts well right away. Story 6. Superficial burns to the face typically occur from barbecue or stove lighting accidents. It may seem like just some singed eyebrows, but if you inhaled it all during the accident, you could have burned the inside of your throat. Most individuals present with normal breathing, but as the injured tissues swell, it can close the airway. Many people feel fine immediately after the accident but may need intubation if they reach the hospital. Story 7. Hit your head hard? Get it checked out. I had a friend who fell out of a chair at a work party and hit their head hard on the ground. They shook it off and started complaining about vision problems over the next several weeks. Their work performance suffered. Then, between work and their spouse, the people around them pieced together that they could no longer read at the same level. It wasn't their vision, it was their comprehension. They couldn't even perceive what was actually wrong. Long story short, it was a serious traumatic brain injury. They had to go on disability and enter rehabilitation therapy for over a year. Many people are not seeing the bigger picture. There are plenty of stories of individuals who could have had surgery to save their lives after a bleed. Thank you for sharing. I am so sorry. Many others might have benefited from earlier interventions or monitoring to help. Yes, there are inadequate doctors who do not take concussions or traumatic brain injuries seriously. Health systems everywhere have them, but there are also good doctors. Give yourself a chance. Additionally, consider the importance of documentation. My friend had to endure the challenges of claiming workers' compensation since the injury occurred at a work event, dealing with several months of reduced duties. Since they didn't get checked out right away, establishing a timeline was tough. It was also difficult to get a proper referral to a traumatic brain injury specialist clinic and physical therapy. Thankfully, things worked out for them in the end, but having documentation and a timeline of changes helped immensely with disability claims. Disability can happen to anyone, including you. Document everything. As for those who care about my friend's gender, that seems unnecessary. I used they because that is their preference. The majority of people do not mind and recognize that it is unrelated to the topic. It's important to stop inserting discomfort and negativity into every situation. Story 8. My stomach was bloated for 5 days. I saw my doctor, who performed an ultrasound and detected fluid in my stomach, which typically indicates cirrhosis of the liver or advanced stage cancer. He advised me to go to the emergency room, where I was diagnosed that night with advanced stage ovarian cancer. Story 9. I had an infection in my toe due to an ingrown nail when I was about 16 years old, and I was given antibiotics. The next day at school, I developed a fever of 104 degrees Fahrenheit, my leg went numb, and the skin on my leg was discolored and hot. The antibiotics I was given weren't effective for some reason, and the infection spread up my leg, leading to cellulitis. I was prescribed different antibiotics, and those worked. At the urgent care facility, I was informed that if we had waited any longer to seek treatment, I might have needed intravenous antibiotics. If you have an infection and start experiencing new or worsening symptoms despite being on antibiotics, consult your doctor or visit urgent care as soon as possible. Story 10. Prolonged breathlessness. Mine turned out to be a serious pulmonary embolism. I am lucky to have survived the 6-hour wait for treatment. Story 11. If you have recently sustained an impact to the abdomen, pain in the left shoulder can indicate a ruptured spleen, although you will most likely experience additional symptoms. Story 12. Red streaks near a wound, particularly on the limbs, can indicate a spreading infection and may be an early sign of sepsis. I know 2 people who had no other symptoms besides the streaks. Both were admitted for sepsis and remained in the hospital for a while. Story 13. Irregular heartbeat should not be ignored. I experienced an irregular heartbeat for a couple of days and went to the doctor. She immediately called an ambulance. I spent 3 days in the hospital's cardiac unit due to atrial fibrillation. They had to sedate me and use cardioversion twice to restore my heart to a proper rhythm. Story 14. Being tired all the time suddenly became a concern. Last year around the fall, we noticed my dad getting tired easily, needing to sit down while walking, and sleeping much later than usual. He had gained some weight, so we suggested he should lose it, as it was obviously affecting him. Even our doctor advised him to monitor his health and eating habits since it was causing him discomfort. Eventually, we decided to have blood tests done to check if he was pre-diabetic or had another issue. The tests revealed he had severe anemia and very high iron levels, which was unusual. They sent him to the emergency room for a blood transfusion, where he met with a hematologist who told him that his bone marrow seemed to have stopped functioning properly. After a week in the emergency room, he was diagnosed with myelodysplastic syndromes, a form of blood cancer, and his only chance for survival was a stem cell transplant. He was fortunate to find a 100% matching donor fairly quickly, and he is now seemingly on the road to recovery. It's always important to consult a doctor. Story 15. I recently experienced back pain from the right shoulder blade down the back. I also had a severe stomach ache and pain on the right side under the rib cage, along with possible dark and thick urine, indicating potential gallbladder issues. Story 16. Pain in one breast after lying on it and feeling a lump in the breast can occur in men. Breast cancer can affect men, and it is important to be aware that doctors may dismiss concerns about it. Do not hesitate to seek a thorough examination through ultrasound, even if you need to get a second or third opinion. I recognize that this may not be a medical emergency, but it is important to raise awareness. Many think it is harmless when it occurs in men, but that is not the case. Story 17. Not really a symptom per se, but if you have received an electrical shock, even if there aren't any burns and you feel fine, there is always the potential that a shock could send your heart into an irregular rhythm, which could be fatal. It is best to be on the safe side and get checked out or have an electrocardiogram done. Story 18. This might seem obvious to some, but a pounding heartbeat and chest pain can indicate more serious issues. I used to think those symptoms were just anxiety, but now I'm facing open heart surgery. Story 19. Before I was admitted to the intensive care unit for 2 weeks, I experienced muscle tetany, which felt like pins and needles in my feet, arms, chest, and strangely enough, my nose for weeks. I initially thought it was just poor circulation, but it turned out that I had undetectable levels of potassium and phosphate, which caused severe damage to my liver and kidneys. I went months without going to the emergency room because I thought I was being dramatic. Never dismiss your symptoms. It's always better to be seen as overly cautious than risk your life. Additionally, for those who are biologically female, losing your period or experiencing prolonged amenorrhea can often be a sign of a larger issue that doctors may attribute to stress. Always get it checked. Story 20. If you feel like your chest is tight and you vomit, go straight to the emergency room. These are common symptoms of a heart attack in women and often go unnoticed. Story 21. Cat bites can easily become infected and can lead to complications. While it is not life-threatening, it is important to visit a healthcare professional soon to have any cat bites examined, even if they are not deep. Story 22. Sudden hearing loss in one ear. If it does not recover within a few hours, go to the emergency room immediately. You have about 24 to 26 hours during which treatment can restore your hearing. After that, it becomes permanent. Story 23. I was 25 weeks pregnant and noticed some watery discharge. I was confused and thought I might have been peeing myself a little. If you search for watery discharge while pregnant, you will find that it is totally normal. I felt otherwise normal, with no cramping, blood, or anything else unusual. I called my obstetrician after about 12 hours of this, just to check in after my husband expressed concern. I expected her to set up an appointment for the next day or suggest going to urgent care in the morning, but she advised me to go to the emergency room immediately. Once I arrived at the emergency room, I anticipated a long wait. However, they admitted me right away. It turned out my water had broken, and I was having contractions 1 minute apart that I couldn't feel, and I was going into preterm labor, which is known as preterm premature rupture of membranes. At 25 weeks, I was still in my second trimester and hadn't planned a baby shower. Labor felt a long way off. I hadn't even started prepping the nursery. I spent 46 days in the antepartum unit of the hospital on magnesium drips, trying to delay labor as much as possible, and ended up having my baby at 32 weeks. After my long hospital stay and some time in the neonatal intensive care unit, he is now a happy and healthy 1-year-old. Story 24. If you have cold or flu-like symptoms and you feel increasingly tired, to the point where all you want to do is sleep, you may have pneumonia. Additionally, your fingers may start to turn blue. Story 25. Not sure it meets your criteria, but my uncle had heartburn and went to take a nap. He did not wake up. It was a heart attack. Apparently, it can feel this way. That is scary. Story 26. Acid reflux. I was diagnosed with a hiatus hernia about 20 years ago. I am a 54-year-old male. After dinner, I tilted my chair back and dozed off in front of the television. I woke up coughing and tasting reflux in the back of my throat. Leaning forward in my chair, I coughed to the point of needing a deep breath, took a gasping breath, and felt that something was wrong. 10 minutes later, it was getting harder to take a deep breath. My wife called an ambulance, and when the doors closed, I stopped breathing altogether. 13 minutes and 42 seconds later, we arrived at the hospital for resuscitation. From there, I went into a medically induced coma for 10 days due to aspirated pneumonia. The gasp of air I took while in my chair filled my lungs with stomach acid. The acid burned holes in my lungs, and I was deprived of oxygen to my brain. Simple acid reflux almost killed me, literally. So be careful. It doesn't take much to visit the other side. I am thankful I returned to my wife and 2 children. My wife called the hospital 3 times a day. For 9 days, she made 27 calls, with the staff telling her there was no improvement, and my family prepared for the worst. On the 10th day, she received the call that I was awake and alive. Thank you for allowing me to share my story. Story 27. How about the reverse? Sudden onset dementia, especially in older women and those who wear diapers, might be the only symptom of a bladder infection. If that is the case, antibiotics will resolve it. Story 28. Frequent vomiting in children, particularly when they wake up, can be a sign of a brain tumor. Vomiting is not always gastrointestinal. If there are no other signs of illness, such as diarrhea or fever, and the child is complaining of a headache, it could be a possibility. Story 29. I experienced pain in my shoulders and back, along with what felt like indigestion. I felt jaw pain, then fainted and was unconscious for about 3 minutes. I broke my glasses, which caused cuts above and to the left of my eye. As a female over 60 years old, I wondered if I was having a heart attack but dismissed that thought. I only went to the emergency room because I fainted, an experience that had never happened to me before. I took an Uber to the emergency room, where my blood pressure during triage was dangerously low. It was not a heart attack. Instead, it was severe pancreatitis that caused my blood pressure to plummet. Apparently, there was a gallstone blocking the duct near my pancreas, leading to acute pancreatitis. After 3 days in the medical intensive care unit, where I was given medication and fluids to stabilize my blood pressure, I was moved to a regular room. I then had surgery to remove my gallbladder and was discharged the following evening. I had no common symptoms associated with pancreatitis or gallbladder issues. Doctors stated that if they had not treated me quickly, my blood pressure would have been incompatible with life. I am recovering and planning to return to work soon. It was the weirdest, most random occurrence. Story 30. More serious and less ordinary. If you have experienced significant compression causing prolonged low blood flow to a limb, the release of compression after a certain point can be very dangerous. Story 31. If your neck pops and you suddenly feel lightheaded, it can get worse. My cousin was driving to work and turned his head to check for traffic. His neck popped on its own, and he felt lightheaded afterward. When he arrived at work a few minutes later, he told his boss what happened and then collapsed. His boss called an ambulance. It turned out that he had torn an artery in his neck. Fortunately, he survived. This is why we are advised not to crack our necks, whether by ourselves or during an adjustment by a chiropractor. Story 32. Heartburn. It was my mom's heartburn and her inability to keep lunch down that led to the emergency room, where she was diagnosed with pancreatic cancer. Story 33. Someone with experience with a herniated disc here. A tingling sensation in the leg may sound harmless, but it is not. Story 34. If you hit your head and briefly lose consciousness but then feel fine, go to the emergency room. The next time you go to sleep, you might not wake up. Story 35. If you suddenly have a sharp headache that feels like you have been hit with lightning, it is often described as the worst headache of your life. Get to an emergency room immediately. That is a thunderclap headache, and it is indicative of a brain bleed. Story 36. I was at the gym doing kangaroo hops when I fell face first. My legs did not move with the rest of my body. My husband, the trainers, and the owner of the gym all tried to tell me to relax and try again. I just looked at them and said, "My legs aren't working." We all brushed it off as strange. It only lasted 30 seconds at random moments throughout the session, totaling about 10 minutes on and off. 5 weeks went by, and during each workout session, my legs stopped working for various activities. If I had gone to the hospital and received clear answers, I could have prevented a very serious onset of functional neurological disorder that left me suffering from seizures every day for 9 months. Some days I experienced 30 or more seizures. They were non-epileptic, and I was not in control of my body. I felt trapped, frozen in place, only able to blink on some days. I often wondered if I had made the necessary changes to live with the disorder during those 5 weeks. Would it have gotten so bad? I had to relearn how to walk, talk, and function without seizures taking over my body. It was rough. Story 37. I experienced a strong feeling of impending doom, exacerbated by extreme anxiety, especially when I was not feeling well physically. Years ago, I faced a situation where 3 different doctors failed to recognize the textbook symptoms of a deep vein thrombosis over the course of a month. As the days went by, I felt worse and worse. During another doctor visit, my blood pressure was dangerously high, and I couldn't walk more than a minute without becoming completely out of breath. Throughout the day, I felt as though I was about to die. I took myself to the emergency room, and I was correct in my concerns. The misdiagnosis of deep vein thrombosis had resulted in severe pulmonary embolisms in both lungs, causing my heart to work excessively hard and nearly leading to a heart attack. I spent about a week in the hospital, and it took months to return to my baseline health. Story 38. We were on vacation. My youngest was 3. I started to notice he wasn't turning his head normally, as if his neck was stiff. There were no other symptoms and no fever. I might not have thought much of it except our local news had just done a story on meningitis, so I immediately called the pediatrician for advice. They said to take him to the emergency room right away. The emergency room didn't have a pediatric unit and couldn't rule out or confirm meningitis, so they rushed us to a children's hospital in a nearby city, where they discovered he had a retropharyngeal abscess. If left untreated, it could have grown and suffocated him. He needed immediate surgery and was back to being his sweet little self after a couple of days in the hospital. Story 39. I changed my answer because someone already provided it. Feeling pain in your lower back that feels like it is moving toward your belly button is a significant sign of appendicitis. You have 48 to 72 hours to treat it before it bursts. Story 40. I experienced repeated itching at night and muscle twitches for about a month, which eventually led to vomiting. I went to the emergency room after a few days, and my kidney function was at 11. I spent a week in the hospital due to acute kidney failure, with my function dropping as low as 6. Took a good 3 months to recover. Story 41. A 911 dispatcher here. 2 things immediately came to mind. First, urinary tract infections in older women can cause a change in mental status that is often misinterpreted as dementia. Second, there is a strong urge to use the restroom, particularly among men. It is fairly common for people to be found unresponsive in the restroom because they were experiencing abdominal pain and believed they needed to use the restroom, when in fact they were having a heart attack. Story 42. If you hit your head hard, go to the hospital. If you fell, knocked your head against something hard, got injured in a fight, or were hit hard while playing sports, you should go to the hospital. It does not matter if you think it wasn't that bad or if you were getting up and walking around. It is better to be safe than sorry. The injury could range from nothing to something requiring immediate medical attention, including serious conditions like a brain bleed that may not show symptoms until it is too late. If you experience a significant head impact, go to the hospital. Story 43. I had a sore calf muscle and thought I overdid it during a workout. Light stretching, heat, and massage seemed to make no difference. It didn't really limit my movement or hurt more after specific motions. It was just sore. About a month later, I started getting short of breath far too easily, even after a short, easy walk, which was out of character for my usual fitness level. I had a nasty cold. I didn't test for COVID, and thought maybe it was the after effects. I didn't realize until later, after I fainted for 3 minutes climbing a flight of stairs and then went to the hospital for x-rays and CT scans, that these issues were connected. It turned out to be a blood clot that probably originated in my leg and eventually lodged somewhere in my chest. Thus began my month in the hospital. We still don't know what caused the blood clot initially. I have not experienced any recurrence since then, and I hope it was just a one-time occurrence. Story 44. Having a fever and a high heart rate are symptoms of a type 2 heart attack. One night, my friends and I were gaming when one of our buddies, who was 30 years old, mentioned that he was getting a fever. An hour later, he noted that his heart rate was over 120 beats per minute and his fever was 40 degrees Celsius. While I would have taken a paracetamol and gone to bed, our nurse friend advised him to go to the emergency room immediately, explaining that a high heart rate is a sign that the body is fighting something, but a heart rate that high is concerning. He arrived at the hospital and it turned out that our friend had experienced a type 2 heart attack. This type of heart attack is not caused by a blockage, but rather by a lack of oxygen due to the elevated heart rate. Our friend may have saved his life, as he would have likely dismissed his symptoms as a weekend cold. He was somewhat predisposed due to significant weight and a fondness for drinking, but he has since turned his life around and is doing great now. Story 45. I thought I had a mild urinary tract infection or a small kidney stone. I have a family and personal history of kidney stones and was in the process of overhauling my entire diet to prevent them. Well, it turns out that wasn't the issue. I had an ovary flip and get stuck. The interesting part is that there was a cyst encasing the ovary, which provided just enough blood flow to keep it from deteriorating while still inside me. It had been flipped for a while, and that cyst saved me from a severe infection or worse. I am not bragging, but I was informed that the pathology team was very excited to see that. I have no clue why I am proud of that. Story 46. Heart attacks in women present differently than in men. One significant sign is constant yawning. While it may seem trivial, it could make the difference in reaching the hospital in time. Story 47. A constant runny nose, especially if it is clear, watery, and coming from only one nostril, can be concerning. If it worsens when you strain or stand, improves when you lie down, has a salty or metallic taste, or is accompanied by new headaches, neck pain, or light sensitivity, it may indicate an issue. This could be cerebral spinal fluid, which should not be present outside your body. Before seeking emergency care for a runny nose, consider wiping your nose with a tissue. If the tissue stiffens when it dries, it is just mucus and you are fine. Story 48. My great-grandfather died from an untreated blister on his foot. Even when his leg changed colors and he couldn't walk, he refused to see a doctor. I tell people he died of toxic masculinity. Story 49. For me, it was a feeling that was difficult to pin down. It was a combination of feeling a bit woozy, like everything was moving slowly, and feeling detached from my body. I could walk, talk, and do things, but it felt strange. So I sat down with a coworker who had experienced a heart attack the year before and described my symptoms as best as I could. He asked if I wanted him to take me to urgent care. I said yes. Urgent care took one look at me and informed me that there were 2 emergency rooms nearby and asked which one I preferred. I needed to go immediately. My blood pressure was around 240/150. I was feeling strange because I was on the brink of having a heart attack or a stroke. I was quickly sent to the intensive care unit, and according to one of the many doctors I saw over that long weekend, I was very close. Hypertension is no joke. Story 50. My dad had an unexplained cough for months. Eventually, he went to the emergency room when he broke his leg. His blood pressure was very low, so they decided to run some tests. Turns out he had cancer, and the cough was an early symptom. Story 51. Slight breathlessness when walking turned out to be severe anemia. A blood transfusion was recommended due to a lack of iron. Story 52. I had an abscessed tooth at a time when I had no dental insurance. It went away after a few days, and I didn't think much of it other than that it just really sucked for those days. Within the next few weeks, my teeth started painlessly falling out. I managed to gather the money to see a dentist again. They did x-rays and found that the infection had killed the roots of all my teeth, and that there was nothing that could be done at that point to save them. And that's the story of why I've had dentures since I was 28. Dentures are inconvenient, but having no teeth is much worse. Implants are nice if you're wealthy, but my full realistic-looking dentures cost about the same as one tooth would cost if I got implants. Story 53. Swelling in the leg along the hamstring, especially if flown recently, can indicate a blood clot. However, in my case, it just means arthritis is acting up. Doctors recommend having it checked out. Story 54. Pain in your calf, even if you didn't bump it or fall, could indicate an embolism. If the clot travels to your heart or lungs, it could be serious. Story 55. Being nearsighted and suddenly seeing what looks like lightning at the bottom of your eyes can be alarming. Part of your eye may be tearing, and you should go to the emergency room immediately. It's rare, but I did not enjoy learning this from my optometrist. However, it's good to know. Story 56. Sudden personality change. People often think this is an obvious sign, but it can sometimes be hard to spot. Your partner may have been liberal all their life but suddenly began voting Republican. They may have liked chocolate but now insist they hate it. They may have always been aggressive, but now they are calm and collected. This could be a sign of some form of process in the frontal lobe, such as a stroke or tumor. Could also indicate that they genuinely changed their mind about something. Many people only realize in retrospect after a diagnosis that their partner did indeed change suddenly. Story 57. If you have sciatica, the pain is typically down one leg. If the pain switches to the other side or occurs in both legs, you need to go to the emergency room. This may be a sign of cauda equina syndrome, which indicates irreversible spinal cord damage and can cause paralysis. Story 58. Sudden high levels of pain in a single testicle. You have around 1 or 2 hours to seek medical attention. Lower back pain accompanied by urinary or fecal incontinence, usually with alternating numbness in the buttocks. This may indicate nerve damage known as cauda equina syndrome. Right-sided abdominal pain with vomiting. One of your limbs feeling colder than the other without explanation, which may or may not be accompanied by pain. If your urine suddenly smells like alcohol, it indicates the presence of ketones. Feces that smell worse than usual and appear shiny and black. If you are being treated for iron deficiency, please disregard this. Inability to pass gas or have a bowel movement for an extended period, accompanied by stomach pain and sometimes vomiting. Story 59. Hopefully, most people know this. A bite from any animal, not just wild or rabid-looking ones, can pose a risk. Even if it's your neighbor's dog, if you are unsure whether the animal is fully vaccinated, it is best to seek documentation. In such cases, go to the emergency room for rabies vaccinations. Story 60. A friend had a cut on her finger while gardening. It became infected, so she used rubbing alcohol and Neosporin. The infection persisted for weeks. When she finally went to the doctor, they discovered she had a rare bacterial infection from something in the soil. After 6 surgeries, they amputated that finger and the one next to it. She nearly lost her entire hand. Story 61. Each of your students has a different sized pupil. This can indicate a brain bleed, mini-stroke, aneurysm, or other brain trauma. Please take immediate action. Story 62. Tummy pain that moves from the center down to the right. I called our national health line and said, "It's pretty sore, but I just want advice." The health line responded, "We are sending an ambulance." I thought it was overkill. Next minute, I was in the hospital for several days with acute appendicitis. It grew 3 times bigger than it should have. They didn't remove it for various reasons, but now I'm convinced I'm immortal. If I hadn't called them, I would have stayed home alone and would probably be dead. Story 63. Cold or flu-like symptoms the day after a near-drowning incident, especially in children, can be a sign of leftover water in the lungs causing secondary drowning. This condition can be easily fatal if untreated. Story 64. For women, if you experience heartburn throughout the day, seek emergency medical attention, as it could indicate a heart attack. This happened to my grandmother on a holiday. She had heartburn all day, and it was suggested that she should go to the hospital. One of her arteries was blocked. Story 65. A cat bite, even from your own cat that is fully vaccinated and even if it isn't bleeding much, can lead to complications. Cats' mouths contain the Pasteurella multisida bacteria, and bites have a high risk of infection with rates up to 80%. The bite can inject this bacteria deep into your skin, and topical soaps and antibiotics may not be effective. You need oral antibiotics to be sure of prevention. Story 66. My mother is a surgeon, so she spends a lot of time in hospitals. A few years ago, she had an itchy spot on her shin that she thought was a bug bite. It didn't improve and became even itchier. She encountered a colleague who is a dermatologist in the elevator and mentioned it to him. He asked her to pull up her pant leg quickly and told her they should go to the emergency room right away. It turned out to be a methicillin-resistant Staphylococcus aureus infection she had contracted in the hospital. It is unclear if she got it from scratching something that already itched or if the infection was the original cause of the itching. She was admitted and put on intravenous antibiotics. They ended up airlifting her to a larger hospital 6 hours away. She underwent a surgical debridement and received more antibiotics. They discussed amputation as a last resort if they couldn't get it under control. Eventually, the medication and multiple procedures worked, and she still has her leg, but she has a significant scar running down the lower portion of her leg. Story 67. My 5-year-old child was crawling around the house after waking up in the morning. She wouldn't walk and said her legs felt funny and hurt. We thought her legs were asleep and it was just a tingling feeling. We called her doctor because my parental intuition felt something was off. The pediatrician told us to go straight to the emergency room. It turned out to be myositis, and the infection was breaking down the muscles in her legs. For days in the hospital later, we were released. Story 68. I developed a mild cold while pregnant, took the medication my doctor said would be safe, and went to take a nap. I woke up short of breath. Honestly, I thought it was because I had finally started showing and was having trouble getting around. I was alone in the country, so I called for an ambulance just to be safe. They said that all of my vitals were great, as well as the baby's, but they could take me in to be absolutely sure everything was okay. The intake lab work showed I was in acute kidney failure due to metabolic acidosis, and without dialysis, both the baby and I would be gone within a few hours. I don't remember any of this because by that point, I was in and out from lack of oxygen to the brain. My now husband arrived at the hospital just as the doctor began placing a port for dialysis, which I was on for nearly 6 hours. I still have no clue what caused the metabolic acidosis. 12 days and over 50 tests later, we were discharged with no answers. Story 69. If you are female, you may experience tingling pain in the chin. Men often feel discomfort in the left arm during a heart attack. Similarly, women may experience pain in the chin. Story 70. Nosebleeds that do not stop require an emergency room visit. Blood loss is serious, and you can lose a significant amount of blood over 20 minutes of nosebleeding. Story 71. A ripping or tearing sensation in the abdomen and a sense of impending doom may indicate a serious condition. It is crucial to seek immediate medical attention. Story 72. I had pain in my lower left abdomen near my menstrual cycle. I started walking funny due to the discomfort. My husband got worried and made me go to the emergency room. I thought I was just experiencing cramps that were a bit worse than usual. It turns out I had an ectopic pregnancy on the verge of rupture, which could have been fatal within 10 minutes, I was informed. Story 73. Gastrointestinal upset with abdominal pain. I initially thought I had food poisoning, but after it lasted more than 4 days, I decided to go to urgent care. An ambulance ride to the emergency department and 1 emergency surgery later, I am currently at home recovering, minus 1 ovary due to a large mass on it that caused it to twist. I almost didn't go because the pain stopped. The pain stopped because I lost blood supply to the ovary, resulting in its death. If I hadn't gone, I could have faced serious consequences. Story 74. Inability to retain water and experiencing immediate vomiting can indicate dehydration or sepsis. Story 75. Any change in consciousness is significant. Hollywood has perpetuated the idea that getting knocked out is not a serious matter, treating many instances of people losing consciousness from medical conditions or blows to the head as mere sudden naps. In reality, losing consciousness is very serious and usually requires immediate medical attention. Story 76. I have several conditions that come to mind. 1. A headache that starts suddenly and has been described as a thunderclap, developing to maximum intensity over about a minute. There are usually accompanying symptoms like sensitivity to light and noise, nausea and vomiting, seizures, and confusion. This type of headache can be a symptom of a subarachnoid hemorrhage, an ischemic stroke where a blood vessel is blocked by a clot, extremely high blood pressure, or infections like meningitis or encephalitis. There are more conditions than what I've listed, but these are the most notable. A bite, scratch, or injury that may or may not be causing any pain, discomfort, or discharge at the site but has surrounding redness and a red line tracking up your skin. This indicates an infection that has entered your bloodstream and could mean sepsis. You need immediate antibiotics to prevent the infection from spreading or worsening. A mole with an irregular border that changes in shape, color, or size could indicate melanoma or skin cancer. Any new lumps and bumps that are solid should also be checked, as they can be a sign of tumors under the skin. Blood in your stool may also signify bowel cancer. If you sustain an injury to the abdomen, for example, a punch to the stomach or a car accident where your seatbelt snaps tightly over your abdomen, and you start to experience pain in one of your shoulders, this may indicate an injury to your liver or spleen, depending on the side of the pain. This is referred to as referred shoulder pain. Sudden chest pain that feels like someone is squeezing a band around you, or that something heavy is sitting on your chest, may indicate a heart attack. This may be accompanied by pain radiating down your arm or up your neck into your teeth, as well as breathlessness and nausea or vomiting. Back pain with saddle numbness, which is the loss of sensation between your legs where your buttocks and genitalia would touch a horse's saddle. Possible incontinence, pain or weakness in the legs, and sexual dysfunction. This is called cauda equina syndrome, and if the pressure is not relieved from the affected nerves, the damage can worsen and become permanent very quickly. Any blows to the head should be taken seriously, even minor bumps. If you or someone nearby experiences confusion, visual disturbances, auditory disturbances, difficulty with memory, trouble recalling details of the injury, or sensitivity to light or noise, medical attention is needed. On a personal note, fatigue can be debilitating. For 6 months, I experienced extreme fatigue, sleeping extensively, having naps, losing interest in meals which led to weight loss, and feeling excessively thirsty. I ended up craving salt, shaking it directly into my mouth to satisfy the craving, and developing brown patches on my skin. Eventually, I had a full adrenal crisis and was diagnosed with Addison's disease. It's quite rare but can be life-threatening if not diagnosed in time, so I was fortunate to have mine caught early. Story 77. An unusually dark stool may indicate bleeding from higher up in the intestines, which is not red and can be harder to detect. This may be a sign of something serious, such as polyps or bowel cancer. Story 78. Funny you should ask, as I am in the emergency room right now. I have several bruises that I tried hard to explain away. My wife, who is a physician assistant, also noticed red dots in some areas of my skin. She said that either one alone is nothing, but both together are concerning. Turns out my platelets are critically low at 8,000. I am 54 years old and live a normal, healthy life. The reason for this is unknown, but my blood will not coagulate if there is a wound, and this low platelet count can lead to spontaneous bleeding. Story 79. Sudden neck pain can be a serious condition. In my case, it was a carotid artery dissection. Despite getting to the hospital quickly, the medical staff failed to diagnose it, which resulted in a stroke. They incorrectly dismissed my symptoms as anxiety. If you experience sudden neck pain, go to the emergency room and insist on thorough evaluation and imaging. Story 80. Not really a symptom, but any fall while pregnant can be concerning. Even if you don't land on your belly, the sudden jolt can cause placental shearing. I had a fall onto my knees during my last pregnancy, and when I called, they told me to come in right away. Story 81. Low-grade but persistent fever while undergoing chemotherapy. Chemotherapy-induced sepsis is the leading cause of death among patients receiving chemotherapy. You already feel terrible due to chemotherapy, so a 99.9-degree fever doesn't change how you usually feel. However, it serves as an alarm bell indicating that sepsis may be developing. I was fortunate to listen to my doctor and went to the emergency room, resulting in 48 hours of intensive care to turn things around. Throughout it all, I never felt worse than the usual chemotherapy sickness, but I was likely only 24 to 48 hours away from being too ill to save. I am now 8 years cancer-free. Story 82. If you are eating or drinking and notice red lines appearing on your lips or down your neck, this could be a precursor to your throat swelling shut due to an allergic reaction. Story 83. Hitting your head. I am not referring to the obvious situation where someone is hit with a hard object and their head is bleeding. Instead, I am talking about the seemingly harmless scenario where someone bangs their head but believes everything is fine because there is no visible blood. I had 2 coworkers who hit their heads and then complained of migraines days later. Each time I urged them to get checked out. Each time, my advice was ignored with excuses like, "My head isn't bleeding. I just bumped it." One coworker passed out on the sidewalk while walking to work the next morning. When the ambulance took him to the hospital, they discovered he was bleeding internally and needed to be rushed to another hospital for a blood drainage procedure. The other coworker did not call or show up for work the next day. A wellness check was conducted, and he was found dead in his bed. Story 84. A cut on your foot can be serious if you have diabetes. My former roommate had diabetes and was very heavy at the time, not taking his condition seriously. He stepped on something small, perhaps a pin or tack, but he wasn't sure what it was. He mentioned it hurt a bit, but only for a minute or two. Initially, he attributed the pain to a flare-up of gout, but then he realized the pain was only in his toe. He went to the hospital, where they told him the wound was necrotic, and since the decay had reached the bone, they had to amputate his big toe. Story 85. Coughing or feeling the need to cough when taking deep breaths could be a sign of spontaneous pneumothorax, which is a lung collapse. I also experienced chest pain, but since my anxiety often causes chest pains, I assumed it was related to that. I felt foolish for going to the hospital until they rushed me into an emergency room supply closet to perform a chest tube procedure. This occurred during the COVID-19 pandemic, when a negative test result was required to leave the emergency room. Story 86. When I was younger, I had a severe heart condition. If I felt an event coming on, we would start moving toward the nearest trauma center. It was like the sensation of needing to sneeze, but in my chest. It was a priority situation at the emergency room. I didn't realize that you could wait in those places until I broke my arm. Story 87. I was experiencing blood in my urine, which turned out to be stage 2 kidney cancer. I had to have it removed immediately. Now, I will have to follow a kidney-friendly diet forever. Story 88. If you suddenly notice a dark or fuzzy spot in your vision, it may indicate a serious condition. This could be a sign of an eye stroke, which may also warn of extremely high blood pressure and could precede an actual stroke. I went from thinking I had lingering effects from staring at a light bulb to spending a day in the trauma ward, followed by a week in the hospital. Story 89. I felt sore after being intimate at around 1 a.m. I thought it had been a while since I had been active and figured I could sleep off the discomfort. The next morning, I woke up feeling dizzy and unable to stand for long periods, with significant pain in my abdomen. I didn't get to the emergency room until 3 p.m., where I fainted while checking in. The doctors informed me that if my ovarian cyst had been any larger, they would have had to perform surgery. That was the day I learned I had ovarian cysts. Story 90. Sudden onset of diarrhea that does not go away. A woman I work out with experienced diarrhea for months after the holidays despite being a healthy eater, exercising regularly, and not consuming alcohol. Fortunately, her doctor ordered specific tests, and they found stage 1 pancreatic cancer. This cancer progresses quickly and is typically diagnosed much later, after symptoms have worsened. She is incredibly fortunate to have caught it early. She underwent successful surgery and is undergoing 10 rounds of chemotherapy as a precaution, but her oncologist is optimistic that she will make a full recovery. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.